No guesswork, we are now in a third wave. But what does that mean for a country whose restrictions have lifted and cases continue to rise? Hello and welcome to On the Record. I'm your host, Jerome Sawyer. Around the world, countries have prepared months in advance for what would be the inevitable third wave. And for this country and others in the region, it's happening much later than the rest of the world. With vaccinations available to all nationwide, easing restrictions seemed like the next best steps. But au contraire. With over 10,000 cases recorded and well over 600 active cases, we are not in a good place. Tonight on The Record, we're discussing managing the third wave. We'll look at the research and medical science behind it, as well as the possible socio-economic effects. Don't go anywhere. Our discussion begins on the other side of this break. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. I'm your host, Jerome Sawyer, and tonight we are discussing managing the third wave. At the beginning of this year, the experts had finally been seeing the fruits of their labor yield profitable results. In January and February, we had a total of 335 new cases. But in March, we saw that almost double with an increase to 610 new cases. By April, a whopping 992 new cases. My guest for this segment of the show is one that we may not see or hear from much, but has been instrumental in getting us through this pandemic. She's the head of the National Reference Laboratory, Dr. Indira Martin. Dr. Martin, welcome to On the Record. Thank you so much for joining us. Well, 2 weeks ago, Dr. Martin, on our show, the director of the National HIV/AIDS and Infectious Disease Program at the Ministry of Health, Dr. Nakia Forbes, made it quite clear to all of us that this was not the time to slack off, as we are now into another wave.
So we are in a third wave of COVID now. So when we first saw the increase in cases, we tried to establish if that was a spike or a cluster or work case exposure. But we saw that cases were gradually going up over a certain period of time. And so when that happens, when you have a sustained increase in the number of cases over time, that's called a wave. And cases are continuing to go up. What do we do about that? We have to try and stimulate that. We have to try and get that under control.
That was Dr. Forbes speaking to us about 2 weeks ago. So, Dr. Martin, we're seeing this significant increase in positive cases month over month. Can we say definitively that these cases are rising as a result of more COVID in the community? Or, as many people have been saying in the past, we are testing more?
I don't know the exact statistics in terms of what the testing has been, but I can speak anecdotally to our experience at the reference lab. And certainly what we found is that there is an increase in cases week on week here at the lab, and an increase in COVID positivity in the cases that we do find. So that's been our experience.
Okay, and do you believe that regular rapid testing has had a hand in the amount of positive tests? Because in the beginning, we really were only doing the PCR test, but now we're doing the rapid test. Are you able to say in any way how that's impacted us?
I think that's a really great question, actually, Mr. Sawyer, and it's something that we're working on actively at the moment, because right now we're doing rapid antigen testing at a number of private labs. It's approved in the country. But the thing is that because of the sheer volume of rapid antigen testing, there's been logistic difficulty from the lab end in terms of uploading all these many thousands of results to the Ministry of Health surveillance system. And also on the ministry end, there are limitations in terms of the data being manipulated and having the personnel to do that, the contact tracing, having the personnel to do that. So I know that there's a lot of active work being done right now to make sure that those rapid antigen test results, in particular, the positive test results, are accommodated by the Ministry of Health and that they are included in the surveillance and contact trace activities.
Now, I mean, that brings me straight into my next question, which has to do with the workload. What has the workload been like for you? Is it different now in this third wave? And, what's your capacity, to handle all of this? I mean, you mentioned a bit of it just a moment ago.
So going back to the first wave, in the first wave, the National Reference Lab was the only lab in the whole country that was testing for COVID. So if you think about it, the whole archipelago, all of the islands, the clinics on each of those islands, the hospitals, the private, even the private hospitals, the private sites, and so on. So definitely in that first wave, the workload was very large. Going into the second wave, we got a lot more help from the private side. About midway into the second wave, a lot of private labs brought the testing on board. So that kind of eased the burden a lot. And it helped us to shift our role to more of a monitoring and evaluation, quality assurance role, and also to a more research and surveillance role. So I would say that now coming into the third wave, we have these additional, I guess I would say, nuances to this virus. So now you have variants. Now you have a lot of labs that are testing for it. So I would say that although the work has shifted, and I think that being the public health lab that has oversight kind of over all of the testing activities that are happening, I think that we have to be constantly evolving in our approach in terms of providing robust information to the surveillance team so that public health decisions can be made going forward as the epidemic changes.
Now the question, I guess, then this next question relates to a discussion that everybody is having within the healthcare system, and it has to do with variants. Can you confirm that we have variants of the COVID-19 in country? If so, are you able to say how many cases that you have seen?
I cannot confirm that we have variants in the Bahamas, but what I can say from our data is that we have detected a mutation. It's actually a deletion in a part of the COVID genome that is characteristic of the variants that are out there, the variants of concern in particular. So the situation we're in with regard to the variants, until we get our sequencing data back from CAFA, is that we have a situation where it's kind of like if you come home and you see all your stuff ruffled up and there's footprints, there's a genetic footprint of a variant being in the country, but we don't have the surveillance footage, so to speak, of this variant in the country, and CAFA has that. They would have that in the genetic sequence, the genomic sequence of this virus that they will provide to us, hopefully this week.
I was just about to ask, when do you expect to get that sequencing data back? So you said this coming week or within days, I would imagine.
Any day now, I would expect it.
So that brings me flat to my next question. Are we going to get to the point where we will be able to test for these variants in country? I do know that there has been quite a significant amount of time that's lapsed since I know that you all started sending off these samples to begin testing. So is there going to come a point in time where we will be able to do these tests ourselves?
It's a very important question. As a developing country, I think we have to take a pragmatic view on it. We have to determine whether there is cost benefit to doing these extra testing, which will involve extra equipment, extra personnel, budgets, and so on and so forth. To some extent, it is understanding the genetic composition of the COVID that is in country is an academic question. And to the extent that it is a public health question that we want to address it, and the strategy that we have taken, balancing all of these various things in terms of cost and labor, is that we have decided to do in-country PCR screening for variants of concern. And what that allows us to do is it allows us to prioritize which samples to send off for sequencing. So given our constraints, I think that's probably the smartest way for us to go about determining what's happening in country genetically, and also probably the most pragmatic way. We don't have gigantic universities like in the United States and in Canada and so on, where a lot of the sequencing is actually happening. So all of that has to be taken into account. Our major objective here and our priority in the lab is to determine who has COVID, regardless of what type of COVID you have, whether it's the original strain or the new variants, because the public health measures apply the same way for both those scenarios.
This brings me now to the final question. You would have just really spoken to our vulnerability as a small, developing nation in a crisis like this. The next time we have something like this, and there is the inevitability, how has this experience prepared us for the next time?
Wow, that is something that I think about, Mr. Sawyer, actually all of the time, because at the same time that this is a pandemic, it's also an opportunity to the extent that in the future we have to prepare now while there's an opportunity again to kind of develop capacities that can be applied in future should this kind of thing arise again. I think that it has exposed a lot of gaps in our abilities in public health, not necessarily just our abilities, but also our capacities in terms of human resources, in terms of technology. And certainly, I believe from where I sit that the building of public health capacity is of necessity when you have a small island developing state. Because when you look at it, for example, I think probably the best example is when this first came here March 15th, 2020 was our first diagnosis. And we were provided those diagnostics via public health mechanisms, via a global public health network. PAHO provided us with the reagents. We had the equipment on hand because we were doing HIV testing and arbovirus testing. And so we were very rapidly, only the public health lab had the capacity at that time to actually test for this incoming virus. So we can see that having public health helped at that point, and going forward, building on that can only help us to respond better in future epidemics and learn from what we've done right and wrong in this one.
Dr. Indira Martin, if nobody has told you, thank you. I remember my very first visit to the lab, and in those days, all the pressure was on you and your staff to turn out the results, and you all did a yeoman's job. You continue to do great work, and we really, really, really appreciate the work that you do. And, as we go into the break, I just want to say that I hope that, at some point at the end of all of this, we all sit down and we figure out those lessons that we've learned, and heaven forbid, when it happens again, we'll be even better prepared, and we certainly couldn't do it without people like you. So again, thank you so very much. The country owes you a debt of gratitude, just in case nobody said that to you before. So thank you.
Thank you so much, Mr. Sawyer. I appreciate you likewise.
All right. Well, don't go anywhere, folks. When we come back, we're going to turn our attention to the president of the Consultant Physician Staff Association. Our conversation continues right after this quick break. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. I'm your host, Jerome Sawyer, and tonight we are discussing managing the third wave that we currently find ourselves in. In a Tribune article this week, former Minister of Health Dr. Dwayne Sands said that the healthcare system is currently under pressure and that any surge of significance will have a disproportionate impact on the healthcare system, even more than the second wave. My guest for this segment of the show is more than qualified to speak on issues regarding this claim. She's the president of the Consultant Physicians Staff Association and a family doctor herself. Again, happy to have with us Dr. Sabriquet Pinder Butler. Doc, welcome back to the show.
Thank you for having me again, Jerome. It's a pleasure.
I just wish that sometimes we could speak under different circumstances, but every time we seem to hit a surge, we're back at this point. So much so that this week your association issued a statement on the fact that there could possibly be a variant strain or variant strains in the country based on the most recent data presented by the Ministry of Health. And it may also impact our vaccination efforts as the vaccine may not work as well on some strains but are far less effective on others. What does this all mean for us?
So, again, I think it was important for our association to speak to members of the public regarding some of the data that was presented by the Ministry of Health. And certainly when we see the surge in cases with COVID-19 now happening, these things are concerning for us. We know that with certain variants, it could mean in simple terms that it would be easier for persons to be able to contract COVID-19. And certainly if it means that the transmission is easier and we're already having an increase in cases, it could mean that more persons may be easier exposed to COVID and could contract the illness. When that happens, Jerome, and we already have a situation where we're seeing community spread, every day our numbers are increasing, more and more businesses are putting announcements out to note that they've been impacted by exposures, and certainly our healthcare institution, because we oftentimes mirror what is happening in the community, is also having similar exposures. Wards have had to be closed. But what is most concerning at this time as compared to, I think, our last ride of this wave of COVID is that in this instance, we still have those same healthcare challenges as it relates to spacing. We perhaps may have even less staff than we did in the first instance because we have lost some of our healthcare providers. We've certainly lost a significant amount of nursing staff. We've lost physician staff. Either they have found employment at other places locally or abroad. And so when you have all of those things coming together, because we know that we will need a team effort to ensure that we provide the best standard of care as possible for all patients, whether they're COVID patients or patients with other medical conditions. I think in recent years, perhaps we've lost more than we would have in times before. And, that could be due to various things. Certainly, the morale of healthcare workers is not as heightened as it should be. We're working in stressful times, and certainly COVID and the pandemic onto that doesn't make it any easier. And certainly certain healthcare workers do not feel that they're getting the respect that they should from the Ministry of Health as it relates to our engagement with the fight with COVID. And so a lot of these factors impact why we perhaps have lost staff during this time. And because it's a global pandemic and countries around the world are also always looking for healthcare workers, we have persons who are being targeted for jobs and things along that line throughout the course of the years.
To what extent would you say that this is impacting, or what you spoke about, to what extent, I guess, fault lies at the feet of the ministry in terms of even trying to rehire healthcare workers? Even now, as we start to vaccinate now, you're talking about, the use of healthcare workers. You're talking about the fact that they're leaving to go elsewhere. I mean, from where you sit, is the ministry doing enough? Are they paying attention to this? Do you think more needs to be done?
Jerome, I know that it is not an easy task for our government right now. I would say that first. I think the government perhaps is doing as best as it can. However, there is room for improvement. Certainly, when we look at the engagement by the government and certainly recommendations that would have been made by our union and other unions, the junior physicians as well as the nurses, we would have made recommendations from as early as last year related to staffing and some of those challenges. We know that it's not an easy plight to find additional help. However, sometimes if we are more proactive with things and, we engage our professional persons in a better manner, it would lend for things to happen in a different light. So I think that these are some of the things that we face related to staffing. Certainly, I think the country should have noted the impact because recently we had abrupt closures of certain services in the hospital. There were memos put out by the Public Hospitals Authority related to certain clinics that would not be able to be conducted, certain other services like elective procedures, because we really don't have the staff capacity to allow for those things to happen, because we're also, as you mentioned, having those same staff diverted to the vaccination campaigns. Again, perhaps some of those same staff members were also involved with the surveillance and testing of COVID-19, which again would impact our ability to be able to properly track persons with COVID-19 as well. And so this might also be some of the reasons too why we maybe even having more persons exposed, because we may have a lag with the actual contact tracing because you're using the same pool of persons to do now perhaps maybe 3 to 5 additional tasks.
Wow. I've got to ask you, based on assertions from the government, Prime Minister and the Minister of Health specifically, there are no plans to retighten or impose further restrictions. Do you agree with that? Does the association agree with that?
So in the first instance, the association wants to reiterate to the Bahamian public at large that this particular fight is going to take all of us to be properly engaged and to do the things that are necessary. It's not just the government, it's not just the healthcare workers, the teachers, it's going to take a community effort. And so we want to firstly reiterate and stress that it's important for all of us to continue those preventative measures that have been found to be effective at reducing the spread of COVID, such as wearing our masks properly, to make sure it covers our nose and our mouth, making sure that we practice social distancing, hand washing, and those types of things. They're still very, very important. When we look at, a critical case of COVID in country, or if we see certain things happening that may lend us to say, hey, if we don't do something now, are we even going to be able to get a handle on this? And so I think when we see numbers increasing daily, and we know that there's a balance between the economic as well as the health of the country, because if your healthcare institution is so overwhelmed that it cannot manage what is happening in the country, at the end of the day, that is a serious, serious problem. And so other countries have had to look at restrictive measures that would have been in place in the past. I don't think that it's something that we should not look at. It may not necessarily be something that we might have to enact if we're able to enact certain policies that will allow for the enforcement of the measures that we speak to, penalties for persons who are not. Enacting those things. I think we spoke to that before. Those things are critical.
So I've got to ask, though, do you think that a portion of the answer lies with enforcement? Do we need to become more strict? Do we need to put in place heavier fines and penalties? I mean, we look at just what happened at Great Cliff over the weekend, and you saw a huge fine levied, but what about the people who were there? When are they going to be held responsible? Yes, the promoter and whomever else, but what about the people who are there who willingly go to these events?
Yes. And that's absolutely the key right there, Jerome. All of us have to take personal responsibility for what is happening in our country. We have to be responsible for ourselves and other citizens who we can negatively impact. And so, yes, I think that, one of the things is the responsibility of each individual who, may be attending these super spreader events, or persons who are not following the preventative measures. There needs to be enforcement of these things, because I think, unfortunately, when we sometimes leave things to our own devices, we see that it still comes back to negatively impact us. And unfortunately, it is impacting the other persons, because there are persons in the country, obviously, that are doing their best. They're trying their best to follow the preventative measures. They are not attending large gatherings and those types of things. And they're also negatively being impacted by what others of us are doing. So I think that we have to really look deep within ourselves as a people and say, hey, what is it that we're doing? We can't continue to play like these things aren't here. We can't continue to wait. A lot of us are saying, oh, I'm just waiting on the competent authority to tell me what to do. You can see what's happening. So you don't need to wait for someone to tell you, don't go to a place that has this. You don't need that to happen. And perhaps, in some instances, in fairness to the government, when certain things were put in place, I know the government did also get flack from some of us.
I was about to say, you're waiting to hear from the competent authority, and then when the rules come into place, you complain about them. So somewhere in there, you're right. It needs to be personal responsibility and not just sort of waiting on directions. I want to move the discussion forward, though, to talk about the vaccine expansion. I think one of the reasons the government has said that they will not move to reintroduce restrictions is because of the vaccine rollout and what is anticipated as a result of that. However, just recently, it was announced one of the stipulations on the vaccine expansion was that it was only for Bahamians, residents, and those who held work permits, basically if you're here legally. Now, in a country like ours, where we know we have a large illegal immigration problem, how effective do you think that will be? Do we run any risks by saying we're only vaccinating now those who are here legally?
So, very good question, Jerome. I think that if it is that we are going to be doing or running our vaccination campaign as best as possible, we have to firstly look at what is happening in our country, and rightly so. We do have a significant amount of persons, perhaps, that may not fall under those criterias that you mentioned in terms of having their documentation to note their status. The challenge with these types of things, certainly when we're talking about a pandemic, something, a virus that can be spread and you're not going to be able to see what's happening. You were talking about ease of transmissibility between persons. I'm not sure if it would be in our best interest to only limit it to that, because at the end of the day, if we continue to have spread in among persons who are here with us, because they are here with us, and this can continue to be a point of focus for further spread, then I would think that it would also be in our best interest to make sure that we reach as many persons as possible with that particular process.
Also, along the lines of vaccination, the Prime Minister recently announced certain privileges that will come into place for those who are fully vaccinated, some of them including inter-island travel without a PCR test, indoor dining, etc., even travel from the US without having a PCR test. Do you think this is a step in the right direction for us, or do you think this may inflict some kind of harm or set us back a bit?
I think that we have to be very cautious with this particular point as it relates to the removal of testing. In the first instance, I think most bodies, international bodies, still speak to one of the mainstays of managing COVID-19 and that direct link with expanding testing. That is still recommended in general, expanded testing for us to be able to note cases. And I think that when we look at the data that we've seen, in particular in the Bahamas, with the most recent data pointing out to us that most of our cases were related to international travel. That in itself means that we identified cases after persons perhaps were in country when they had to do the repeat test, which is concerning. Certainly, yes, the hope that the vaccination will allow persons to have a less chance of transmitting COVID is there, and to be able to pass it on to persons, that chance is also supposed to be reduced. But we don't know what that chance is. And when you don't know enough information about something, I think to just remove that caution tape that allows us to still be able to know what is happening with persons who are coming into our islands would be something that could perhaps cause us to even have further cases of COVID in country and would not allow us to see exactly what is happening. So I think we should really be cautious with that.
Dr. Sabriquet Pinder Butler, thank you so much. You always bring such great wisdom to the show. And our discussion tonight really just proves that there are so many unknowns. A year plus into this, we are still learning, we are still adjusting. It's important to note that even in this third wave, I think we're in a better position than we were before, but there are still so many risks and so many unknowns. So, like you said, we've got to encourage personal responsibility. So if there's anything I want folks to take away from this particular part of our discussion, is that it's personal responsibility. We all have a role to play in this. It's not the government, it's not the healthcare system, it's not just it's all of us. So again, thank you for your great words of wisdom. Continue to be safe, continue to do the great work that you do.
Thank you, Jerome, and again, it's a pleasure. Please continue to be safe, Bahamas.
Thank you so much. Well, coming up in our last segment, we're going to switch gears to talk about the socio-economic outlook of what a third wave will mean for the Bahamas. Stay with us. We're back with more On the Record right after this. Every new season of On the Record, we push the limits. Venture into unknown territory. We take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV Cable Channel 212 and streaming live on Facebook on the R News Bahamas page. And welcome back to On the Record. Thank you so much for staying with us. This is our final segment. Of course, I'm your host, Jerome Sawyer, and tonight we've been discussing managing the third wave. We're finally beginning to see what could be the rebound of the tourism sector and possibly our economy, with so many restrictions now lifted and people returning to work. But amidst it all, we now find ourselves in a third wave. My guest for this segment is the president of the Bahamas Hotel and Tourism Association, Mr. Robert Sandy-San. Sir, welcome to the show. Give us some insight into the importance of the industry reopening or rebounding or getting restarted at a time like now.
Thank you for having me on. It is so important that the hotel and tourism sector reopens, simply because it's the linchpin of the Bahamian economy. It creates in excess of 2/3 of all the jobs, and it creates the economic engine for the country to survive. But what is equally important is that we open safely and that we create an environment not only for the persons who work within the industry, but the tourists that come to the country to feel safe and be safe at the same time. And I think the sector has done a remarkable job in doing just that. The COVID-19 protocols that have been put in place at many hotels throughout the archipelago, I think have benefited the Bahamas, and we're beginning to see an increase in demand and booking pace for the destination. And we've also seen bookings continue to rise on a week-by-week basis.
Almost parallel to the bookings and the inflow of tourists has been the rise in our COVID numbers, so much so that just recently the U.S. would have issued a travel advisory. Have we seen, or have you all noticed an impact on the bookings and the rate of arrivals as a result of the numbers climbing, as well as that advisory?
We have not, but it is certainly a concerning factor, simply because one of the metrics used for potential customers coming to the destination are advisories by the CDC. And that is an extremely important metric for us. And we are not going in the right direction when it continues to move from a category 3 to a category 4. It should be going in the opposite direction. And we are hopeful that we can begin to address this particular issue going forward by being more disciplined in terms of exercising the protocols. Now is not the time to let our guard down when we've made tremendous progress in the last couple of months to get us where we are today.
Sandy, do you think Bahamians in general understand their responsibility and their roles in all of this? Whereas we don't all work in the hotel sector, we all have a responsibility, I would think, to ensuring that our destination is safe. Do you think we get it? Do you think we really understand what our individual roles are as Bahamians?
I would say that the majority of Bahamians do. But there is that percentage in the population that have not taken it as seriously as others. And it's that sector that we have to pay some attention to. I think that we can also do a much better job in terms of enforcement. And I think recently we would have seen some penalties levied at persons who have broken these protocols. I think we have to have some zero tolerance to enforcement to ensure that the protocols that are in place are adhered to.
So interesting you would bring up protocols. I want to talk about, from your perspective, those protocols that are in place within the industry, and particularly within the hotel. The larger hotels are having events on the inside, and when I say events, bars are open, other things are open, and Bahamians are being allowed on property. What kinds of protocols are in place to ensure we don't have a super spreader event, let's say, at one of the hotels?
Well, first of all, to come onto the property, you must be in possession of authentic COVID test. Certainly, we have stepped up personally at our particular property the surveillance in that particular area and the checking of these documents. And they have to be valid within a particular time frame. That is the first issue, just to get on property. Secondly, all events or food and beverage opportunities that we have, we go out of our way to ensure social distancing and mask wearing and making sure that those protocols on property are in place. It is a commitment that we have and something that we have demonstrated, and many, if not all of the hotel properties are working very hard to ensure that those protocols are maintained.
So we're now into this third wave. The government has said repeatedly that they don't see a tightening of restrictions or the imposition of those restrictions again. But what real threats would you say a third wave poses to our country, economy, and hotel industry?
Well, I think the threat is that we cannot go back to where we were because it'll be very difficult to rebound again. But let us focus on what I believe are some of the positive initiatives that are taking place. Rollout of the vaccine, and notwithstanding that we don't have enough of those in countries as yet, I think the rollout of the vaccine is a very, very important element in the fight against COVID-19. And the quicker we can get more vaccines in the country and get more people vaccinated, I think that will be a very positive arrangement. Secondly, we must continue to test. We cannot drop our guard down. We must test. That is very important. Thirdly, we must enforce the protocols. There's no question in my mind that is our biggest opportunity today, enforcing the protocols. We must have zero tolerance in this particular area because this fight against COVID is everybody's business, not a sectorial business. It's every single citizen's business to work on this, to make sure that we work together to have it eradicated. Thirdly, we must ensure that whatever we do to encourage visitors to visit the country, that they are also protected as well. That is why I think the initiative of fully vaccinated persons coming to the Bahamas is a good thing, because certainly then we know that not that they're not able to catch or spread COVID-19, but it will have a lesser impact on our healthcare system because the vaccine will protect them to a large degree from very serious illnesses, etc., going forward.
So you think then that the decision to exempt those who are fully vaccinated from taking the PCR test to come into the Bahamas, whether you're a visitor or a Bahamian, you think that's a positive and a good thing?
In my opinion, this is all about balance, eh? We must balance the needs of the healthcare sector at the same time of balancing the needs of the economic sector in the country. And I think what we have to look at is that this is something, fully vaccinated people is still a work in progress. The numbers are growing over a period of time. So from maybe by the middle of the summer, the United States would be much further ahead than we would be. But at the same time, hopefully the Bahamas would have gotten to a point where we're getting closer to herd immunity as well. And that would be a very positive arrangement, both for a delivery country of tourists to a receiving country of tourists.
There is the thinking, and several individuals in government have espoused that one of the reasons that the restrictions may not be imposed is that the vaccine rollout is moving ahead, and it appears more people are becoming vaccinated or starting their process to getting full vaccination. Just recently also the Prime Minister announced incentives or privileges for those who are fully vaccinated, among them indoor dining. If you could, let's speak to the importance of those who will be working in these establishments, the importance of those individuals being vaccinated?
Well, this is a matter of major debate at the moment. We can only continue to encourage our associates to be vaccinated and continue to promote the benefits of being vaccinated. And every day we're seeing some increases and improvements in persons wanting to be vaccinated. So we must continue that particular process. But, they would be less implicated in terms of being seriously affected with a restaurant full of fully vaccinated individuals than they would be with persons who have not even taken the vaccine at all. So I think these are some positive small steps that will certainly grow into big steps as we move forward.
We also recently saw a business place making it mandatory for employees to be vaccinated, in that they said, we won't keep you on if you don't get vaccinated. That raised, of course, or sparked a huge debate. When you talk about the implications of something like that, I mean, and I don't know how many other establishments may be considering that, but once you get into businesses and restaurants talking about mandatory vaccinations, what then becomes the implications for individuals in the hospitality industry, those who may choose not to do it? I mean, there's so many implications, but what are the implications for those who work in hotels, restaurants, etc., who have chosen not to get vaccinated or said, we won't do it at this time?
Jerome, this is like a debate on corporal punishment and hanging, etc. The law is law,
Yeah.
I mean, we could talk about it, we could debate it, until the government decides that this becomes a position as a matter of law. It cannot happen without penalty. I think that's the end of the debate. And I don't think we should waste too much time on individuals deciding what they may or may not wish to do. There are laws that mandate what we can and cannot do. That type of decision cannot happen without, I think, some legislative change to the country. I get what they're trying to achieve, etc. But, let's get beyond that. Let's deal with what it is within our grips to control. And that is to continue to encourage people to do the right thing, make the right decision, get vaccinated, exercise the proper COVID protocols, be respectful of others, etc. in this environment.
Give us, if you can, this is our final question, a snapshot into the next 3 to 6 months in tourism. What is it looking like? What kinds of things can we expect? And anywhere in there will we see possibly the reopening of downtown?
Well, there are a number of things that are happening, Jerome. I am cautiously optimistic that the summer will be better than the winter because momentum is building. I think there is pent-up demand for travel for individuals. Many people feel that they've been out of the opportunity to travel for over a year. That's number one. Number two, I think that the vaccine rollout has helped individuals to make a firm decision to travel. So that will continue. This whole issue of home porting in terms of cruise ships with limited berths and smaller cruise ships within the Bahamas, I think will be a economic stimulant to the tourism sector, whereby certainly cruise ships will be going from port to port within the Bahamas, creating opportunities for employment, creating opportunities for different vendors to benefit, creating opportunities for greater spend of tourists. I see that also as incremental. It'll be a much more dynamic impact than just the traditional cruising that we would have seen in the past. I think you may even see the spend 400% or 500% higher from cruising in this type of way versus the traditional sense of way. So I think that is a very positive issue. From the marine and private and pleasure boating side, we see that that is a robust sector that is beginning to take off again. So I am bullish and hopeful that over the next 3 to 6 months, we're going to see an improvement, certainly in tourism, barring any other environmental catastrophes that we've been subject to in the last 2 or 3 years.
Makes sense. Robert Sands, thank you so very much. We're all praying for a good hurricane season. We haven't had that discussion yet, but you know we're on the cusp of that. So hopefully we have another quiet season this year.
Almost non-existent.
Non-existent. Thank you very much, Sandy. I appreciate it as always. Great insight. That's going to do it, folks, for this week's episode of On the Record. Managing the third wave, as always. Let's continue to stay safe, practice social distancing, and not let our guards down. A very special thank you to all my guests today, to my production and technical staff. I couldn't do it without you. Certainly couldn't do it without the audience. We appreciate you as always. We look forward to seeing you again next week, same time, same place, right here on The Record.